So at AMN, we constantly get called on a daily basis from the public asking, do you know a trusted doctor? And then we also get medical and health professionals asking us, do you know that I'm dealing with another misdiagnosis? So the problem is very big, and I'm grateful that Gigi recommended that we look into this, because when I started to explore it, I was blown away with how bad it is. So today we're going to look at a framework on what that new quality assurance process should look like. And I'm also going to touch on the private health insurance, because that's another big problem for us. And what I want us to bear in mind together is that this is our problem. It's not a government problem. It's not a doctor problem. It's an our problem. So I hope that the solutions that I provide today will help you. So, where am I? Okay. So what are some of the problems? So there's a study that came out in 2020 that shows that 140,000 Australians are misdiagnosed every year, or their diagnosis is delayed. So 21,000 of those are a serious harm, which then result into 2,000 to 4,000 deaths. Now in the US, it's 1 in 20 Americans, and that's about 16.7 million Americans a year that suffer from this problem too. Now, what I find interesting is that when we look at the government's response to the pandemic back in 2020, they were tenacious, they were swift, they locked us down, they were very clear about this is a problem, we've got to save lives. Now, I think from their records, their data, something like 13,500 up to 13.8 passed away from COVID. Now, don't you think that this problem equally deserves a tenacious response?